So the whole systems approach to obesity is an attempt to take systems science that works and that's been used elsewhere and translate it into a context where local government and their partners can actually make changes on obesity, not just at the individual behavioural level, but at some of the kind of system level things like food availability, food culture, the types of food that are available in our organisations, making self-propelled transport second nature, that kind of thing. So it's an attempt to give them an umbrella approach and a series of things that they can consider and sense check how to implement. The Association of Directors of Public Health and Local Government Association have been in since the beginning. We worked with PHE on the concept for the programme. We worked with PHE on the procurement exercise. We've been on the steering group. We helped find local authorities to pilot and then to test. And we've kind of journeyed alongside them for the last 4 years on this programme. I think there's probably several bits of advice I'd give local authorities if they're going to use this for a whole systems approach. And the first thing is, before you do anything, sit down and read the roadmap and the toolkit and really think through it. So it's worth a day of your time just investing in that. And get your head around the systems approach. The second thing is, use it as a sense check to say, well, we're doing this, we're not doing that. What could we do more of? What could we stop doing? What should we prioritise? And the third thing is, get together a gang of partners relevant to whichever priorities you choose to kind of build the approach, and then start writing your action plans once you've got the understanding, I think, of the roadmap. I think there's several ways in which local authorities have contributed to the guide and to the resources. The first of all, of course, is those 4 pilot sites that went before anybody else. They did a huge amount of work. And there was a district, a county, a London borough and a unitary. And they did some great work. And then after the learning that they brought out of it, came a second round of authorities testing it. And we were one of them, and so we contributed back in, this works, this doesn't, we don't understand this, what do you mean by that, we could do with the guide better. And we spent a lot of time inputting collectively into the guide. And then there was a whole learning community of local authorities that came together for 2 or 3 events. And they contributed by trying the stuff out, sense checking it. In fact, I can remember Paul Gately from Leeds Beckett standing in front of an audience of 100 people, working them through bits of the toolkit and saying what works, what doesn't. So I think local authorities have been through this and in this all the way along since the beginning. So in Hertfordshire, we were lucky enough to be part of the kind of community of learning that's been going along around this, and we also became one of the second stage test sites, if you like. So we worked with 1 borough and then 2 boroughs to kind of implement that. So we worked with East Hertfordshire District Council, which is one of our 10 districts and boroughs, looking at an approach. Then on top of that, we've actually just taken a report through our cabinet to say that we're going to use this all across Hertfordshire and the principles, and we've got members to sign up to the principles. And we now have a deputy cabinet member whose focus is going to be one bit of the whole obesity systems work. So we think we're building the leadership to do that. And we've got a list of things from the very clinical right up to the kind of whole systems planning infrastructure from our whole system work. So we've got enough work to keep us going for 20 years. I think it does it by first taking a systems approach. So for me, the big thing lacking in health and health policies is a systems approach and using systems science. So how do you build healthy older ageing through future housing planning, for example, is one area for health and health policies. Well, the obesity question is the same. I think the second thing that it does is it actually enables us to get partner agencies to look at everything they can do and act on it. So is the food choice in our hospitals, shops, unhealthy? If that's the case, what can the NHS do about it? Can we actually build in activity and standing throughout the day? Can we build in healthy food choice in all our canteens? So I think it's a perfect focus example of health in all policies. I think you need a collective vision for obesity that goes far beyond public health for several reasons. First is, if this just falls in the direction of public health, it won't happen. Transport, planning, school catering, libraries, elected members, the planning of local takeaways, they've all got a big contribution to make to obesity and healthy weight. And so teams right across the council and all they do need to be part of that. So, and actually you need to have a collective vision for what you're going to achieve. If you've got these disparate groups, we need to all know what it is we're aiming at. And the whole systems approach can help us because it gives us a framework for that collective vision. And actually identifying, well, my bit of this jigsaw puzzle is this. So it's a way of unifying the jigsaw puzzle and getting us all on the same page, as it were. To my own view, is local authorities' role in implementing this and meeting this is firstly through political leadership. This is something that elected members can do par excellence because they are the democratically elected leaders of place. So they are the people who are front and centre leading this. Secondly, the Director of Public Health can bring the expertise of her or his team to this. And that's really importantly. But thirdly, all the place functions of local authorities, like planning and everything else, are absolutely crucial to this. So I think local authorities have that wider overview of place that if it were led by the NHS, I'm not saying it wouldn't be good, but it would have to focus on things the NHS can do. And that's one bit of the jigsaw, but you need that much wider approach. So I think if you want to work with other stakeholders like the NHS to do this, the first thing to do is start with a first principles conversation. What are we both trying to achieve? What does the system science behind this tell us what we need to do? Then, right, fine, where are the policy hooks in the long-term plan and in your CCG business plan or your trust business plan that will help us implement this? And how can we work together? And what is your job? And I like to come out of these things with an agreement of, right, here's the jigsaw. This is your bit of it. We really want you to do it well. This is what you're going to focus on. Brilliant. Thank you very much. I think there's one other thing the NHS can do, which is the NHS is an anchor institution, making the health of its staff the very best it can. And that's a really important contribution. So if you've already got local plans in place, the first thing I'd say is don't ditch them. Is just park them, keep going, then go and sit down, read the toolkit, work out what you need to do. Then once you've done that, make an appraisal of whether these are right or fit for purpose, higher priority or lower priority, and then just rearrange and reshuffle them in. But don't just kind of scrap things for starters, because I will bet that you will find some of the stuff you've got is absolutely spot on, and some of it maybe needs a bit of adjustment, and some of it could be done later, and then you develop an order of things. That's what we found. First, actually have a seminar for our elected members on what it is, so they can get their head around it. We've already done one of officers and stakeholders. We've taken a report through Cabinet that says we'll adopt this approach on obesity and we'll start to do it. We're in the phase of trying to do the action plan with all 10 districts and our NHS partners and everybody else at the minute. We're continuing with some of the actions we've already identified. So we've already identified early work on planning and early work on transport and physical activity legacy. And then we're going to use it in mental health, because we started using it in mental health 2 years ago. So we've got a 20-pillar approach in mental health for a whole systems approach to mental health, and we're refreshing that and using it. And once we've done it in mental health, we're actually then going to try doing it on children's health, of what does it look like for a child to reach adulthood healthy and well adjusted. So I'm a bit of a systems science geek anyway. I'm a complete anorak about it. So I find it really, really helpful. So to me, it's kind of bread and butter. I realise other people might be a wee bit sceptical about it. And I think use it in obesity. If you can't work it in obesity, then there's no harm in trying it in another area and then coming back to obesity.